ADHD and Decision-making, The Brain at a Crossroads. Written, recorded and published by ADHD Education. Introduction. From the mundane to the monumental, decisions shape our paths, define our futures, and reflect our identities. Yet, for individuals navigating the world with attention deficit hyperactivity disorder, decision-making can often seem almost impossible. ADHD, a condition marked by symptoms of inattention, impulsivity, and, for some, hyperactivity, uniquely alters the landscape of decision-making, transforming it into a terrain rife with challenges. But what is it about ADHD that intertwines so intricately with the art and science of making choices? This guide embarks on a journey to unravel this question, delving into the neurology of ADHD and its impact on the decision-making process. It aims to illuminate the shadows cast by inattention and impulsivity on the paths to our choices, offering insights and strategies to navigate the crossroads more effectively. As we explore the neurological underpinnings and behavioral manifestations of ADHD, we also recognize the power of understanding and adaptation. The objective here is not merely to outline the hurdles but to highlight the journey toward empowerment and mastery over one's decisions. Through a deeper comprehension of how ADHD impacts decision-making, individuals can discover tailored strategies that harness their unique strengths, transforming challenges into stepping stones toward a more directed and fulfilling life. So, let us step forward with curiosity and openness, ready to explore the nuanced interplay between ADHD and decision-making. In doing so, we affirm the belief that with knowledge comes power, the power to navigate the crossroads of life with confidence, making decisions that reflect our true selves and our visions for the future. Section 1. The Neurology of Decision-making in ADHD. At the heart of decision-making lies a complex network of brain regions, neurotransmitters, and processes, orchestrating together to guide us from contemplation to conclusion. For individuals with ADHD, this orchestration encounters unique challenges, shaped by the condition's neurological foundations and symptomatology. Understanding these challenges begins with delving into the ADHD brain, examining the elements that play pivotal roles in decision-making. ADHD is characterized by an imbalance in neurotransmitters, notably dopamine and norepinephrine, which are crucial for attention, motivation, and the brain's reward system. These chemical messengers facilitate communication across neurons, impacting our ability to focus, anticipate consequences, and control impulses, all essential components of decision-making. In ADHD, the dysregulation of these neurotransmitters can lead to difficulties in weighing options, foreseeing outcomes, and making choices aligned with long-term goals rather than immediate gratification. Central to the decision-making process are specific brain regions, including the prefrontal cortex, which oversees executive functions such as planning, impulse control, and working memory. Studies have shown that individuals with ADHD may experience reduced activity in this area, contributing to challenges in organizing thoughts, considering future consequences, and staying focused on the decision at hand. This diminished executive function can make even routine decisions feel daunting, as the brain grapples with maintaining attention and filtering distractions. Furthermore, ADHD symptoms themselves, ranging from inattention and distractibility to impulsivity and hyperactivity, directly influence how decisions are made. Inattention can lead to missing crucial details or failing to fully explore options, while impulsivity may prompt snap decisions without adequate consideration of repercussions. For those with the hyperactive impulsive presentation of ADHD, the internal drive for immediate action can overshadow the patience required to deliberate and choose wisely. Diet and nutrition also play a significant role in the neurological health of individuals with ADHD. As discussed in the exploration of ADHD and nutrition, the foods we consume can affect brain function and, consequently, decision-making abilities. A diet that supports brain health, providing the nutrients necessary for neurotransmitter balance and cognitive function, can help mitigate some of the decision-making challenges faced by those with ADHD. Incorporating a balanced intake of amino acids, omega-3 fatty acids, and essential vitamins and minerals can support the neurological underpinnings of decision-making, offering a nutritional foundation for improved cognitive processes. In recognizing the neurological intricacies of ADHD and its impact on decision-making, this section sets the stage for exploring strategies to navigate these challenges. By understanding the brain's workings, individuals with ADHD can begin to tailor their approaches to decision-making, leveraging insights into their condition to foster a more deliberate and considered path through life's myriad choices. Section 2: ADHD and the Paradox of Choice. In a world brimming with endless choices, from the minute to the monumental, the act of making decisions becomes an art form, one that can be particularly complex for individuals with ADHD. This complexity is magnified by the paradox of choice, a phenomenon where an abundance of options leads to increased anxiety and decision paralysis rather than empowerment. For those with ADHD, this paradox can transform decision-making into a Sisyphean task, where the hill of choices seems perpetually steep and the boulder of indecision, insurmountably heavy. The ADHD brain, with its unique neurology and symptomatology, interacts with the paradox of choice in ways that extend beyond the realm of neurotypical experiences. Hyperfocus, a symptom often associated with ADHD, can cause an individual to become so engrossed in evaluating the minutiae of each option that they lose sight of the bigger picture. Conversely, distractibility can lead to a superficial assessment of choices, making it difficult to commit to a decision due to a fear of missing out on better alternatives. This oscillation between hyperfocus and distractibility can trap individuals with ADHD in a cycle of overanalysis and hesitation. The role of impulsivity in ADHD adds another layer to the decision-making challenge. Impulsivity may drive snap judgments, with decisions made on a whim rather than through careful consideration. While this can sometimes bypass the paralysis brought on by the paradox of choice, it often leads to outcomes that might not align with one's long-term interests or goals. The immediate gratification of making a quick decision can overshadow the potential benefits of a more thoughtful approach. To navigate the paradox of choice, individuals with ADHD can employ strategies that reduce the cognitive load of decision-making. One such strategy is simplification, which involves deliberately limiting the number of options to consider. This can mean setting personal criteria for decisions in advance, thus filtering out less relevant choices and focusing on those that truly align with one's values and objectives. Another approach is to allocate decision-making energy according to the significance of the decision, recognizing that not all choices warrant the same level of scrutiny and deliberation. Structured decision-making frameworks can also provide a scaffold for individuals with ADHD, offering a step-by-step process to evaluate options. Techniques such as pros and cons lists, decision trees, and the Eisenhower matrix help in organizing thoughts and prioritizing factors relevant to the decision. These tools introduce a methodical element to decision-making, counteracting the tendencies toward impulsivity and indecision. Incorporating mindfulness practices into the decision-making process can further aid individuals with ADHD by enhancing focus and reducing impulsivity. Mindfulness encourages a present-centered awareness, allowing for a more grounded evaluation of options and a reduction in the overwhelm caused by an abundance of choices. By fostering a state of calm and clarity, mindfulness can pave the way for more intentional and aligned decision-making. ADHD and the paradox of choice intersect at the crossroads of cognition and emotion, presenting both challenges and opportunities for growth. By understanding this interplay and employing strategies to mitigate its effects, individuals with ADHD can transform their approach to decision-making. Through simplification, structured frameworks, and mindfulness, the journey through the landscape of choices becomes less about the burden of options and more about the empowerment of purposeful selection. Section 3: Strategies for Enhancing Decision-Making Skills in ADHD. Navigating the decision-making process with ADHD requires more than understanding its challenges. It demands practical strategies that can be applied in everyday life. For individuals with ADHD, developing and refining these strategies is crucial to enhance their ability to make decisions that align with their goals and values. This section offers actionable tips and techniques designed to bolster decision-making skills, tailored to the unique experiences of those with ADHD. Creating a decision-making process. Developing a structured approach to decision-making can significantly benefit individuals with ADHD. This process begins with clearly defining the decision to be made, identifying the objectives it needs to serve. Breaking down the decision into smaller, more manageable components can reduce feelings of overwhelm and make the task appear more approachable. Setting a deadline for making the decision is also vital, providing a concrete timeframe that helps to keep procrastination at bay. Leveraging external supports. External supports, such as checklists, reminders, and decision-making apps, can serve as valuable aids. These tools can help keep track of the decision-making process, ensuring that all necessary steps are taken and that important factors are not overlooked. For decisions that require gathering information, setting up a system for organizing and reviewing this information can be particularly helpful, ensuring that it is accessible when needed for comparison and evaluation. Engaging in reflective practices. Reflection plays a crucial role in effective decision-making. Taking the time to reflect on past decisions, both successful and not, can provide valuable insights. This practice can reveal patterns in decision-making that may be helpful or hindering, allowing individuals to adjust their strategies accordingly. Journaling about decisions, the thought processes behind them, and their outcomes can be a powerful tool for this kind of reflection. Prioritizing self-care. Decision fatigue is a real and significant challenge, especially for individuals with ADHD. Ensuring adequate rest, nutrition, and physical activity can help maintain the energy and focus needed for making decisions. Mindfulness and relaxation techniques can also reduce anxiety and improve cognitive function, making the decision-making process less taxing and more effective. Seeking input from trusted sources. While the final decision should always rest with the individual, seeking input from trusted friends, family members, or professionals can provide new perspectives and valuable advice. It's important, however, to distinguish between seeking guidance and relying on others to make decisions for you. The goal is to gather information and insights that will inform your decision, not to abdicate the decision-making process to someone else. Building confidence through small wins. Confidence in decision-making can be bolstered by celebrating small wins. Starting with less critical decisions and gradually working up to more significant ones can build a sense of competence and self-assurance. Recognizing and acknowledging when a decision leads to a positive outcome reinforces the belief in one's ability to make choices that align with desired goals. Fostering a growth mindset. Finally, adopting a growth mindset toward decision-making can transform challenges into opportunities for learning and development. Viewing each decision as a chance to learn, rather than a potential mistake, can alleviate the pressure associated with decision-making and encourage a more positive, proactive approach. By integrating these strategies into their decision-making processes, individuals with ADHD can enhance their ability to make thoughtful, informed choices. Each strategy offers a way to navigate the complexities of ADHD and decision-making, empowering individuals to take control of their choices and, by extension, their lives. Conclusion: empowering choices. In navigating the intricate landscape of ADHD and decision-making, we've journeyed through understanding the neurological underpinnings, contended with the paradox of choice, and armed ourselves with practical strategies to enhance our decision-making prowess. This exploration illuminates the complex interplay between ADHD and the choices we face daily, highlighting not just the challenges but the pathways to overcoming them. Empowerment emerges as the cornerstone of this journey, a recognition that, despite the hurdles ADHD may present, there lies within each individual the capacity to make decisions that reflect their true aspirations and values. The strategies and insights shared throughout this guide are not mere prescriptions but tools for crafting a personalized approach to decision-making, one that acknowledges the unique contours of ADHD. As we conclude, let us carry forward the understanding that decision-making, with ADHD, is not an insurmountable challenge but an opportunity for growth and self-discovery. By embracing the strategies that resonate with our individual experiences, we can transform decision-making from a source of stress into a channel for empowerment. With each choice made, we step closer to a life that aligns more fully with our goals, values, and visions for the future. Thank you for joining on this exploration. May the paths you choose be guided by wisdom, bolstered by strategies, and enriched by the profound understanding of how ADHD shapes, but does not define, your capacity to make empowering decisions.